Hello, everybody, and welcome. I'm so excited for an amazing interview we have planned for today. I'm joined with the lovely Dr. Kristina Pakiz, and she is with her brand new practice, Vivify Fertility Health, where she specializes in gynecological surgeries and helping women with any amount of gynecological issues you may have. So, thank you so much for joining us today, Dr. Kristina.
Thank you for having me.
Yes, I'm so excited for this conversation. I just think that NaPro technology, which you are trained in, is oftentimes really misunderstood or people don't know about it, which is always so sad that oftentimes NaPro ends up being further into a woman's fertility journey. So I'd love to get started by just having you share how you found out about NaPro.
Sure. Well, while I was in college, I was kind of learning more about my Catholic faith and the teachings of the church. And so I was looking into the topic of contraception. And I had learned about, natural family planning. And I came across this book where all of these doctors had trained in at the St. Paul VI Institute in Omaha, Nebraska, and they had kind of ditched contraception and adapted this new technology and charting system to their medical practice. And so, not all of them were Catholic, and but they kind of tell their conversion stories. So, I was basically from Omaha, so I thought, well, why have I never heard of this place? And so at that point in time, I had not heard yet if I was going to be accepted to medical school. So I was looking for a job, and they have a hormone laboratory, and I studied chemistry. So I thought, well, maybe I could get a job there. And so I emailed the contact person, and I ended up getting a summer job there as a research intern because I did get accepted to medical school. So it was a wonderful, turn of events in my life. But it was really strange because I was on the website and I kept saying, well, what's so revolutionary about NaPro technology, right? I
Yeah.
figured there was some new technology or testing that was performed there. And so when I found out, it's basically just diagnosing the underlying cause and treating it. I thought, well, why is that revolutionary? Isn't that what doctors do? So, of course, I mean, I was naive to the fact that as soon as the birth control pill was invented, that became the go to treatment for basically all gynecologic diseases. And nowadays we have other devices and implants and um, modalities for treatment, but it's basically the same concept. It's suppressing a woman's body and kind of taking over for the system. So I just thought, why is this common sense approach so revolutionary? And yet it is. So I found out about it early in life, which was really helpful.
Yeah, that's amazing. That's so beautiful. Yeah, and it's so frustrating to for women that we see and help, but it's so sad that that is still the state of affairs in women's health. And I'm so thankful for doctors like you that are being a part of that change to really help change the tides of what's going on in women's healthcare.
Yeah, I mean,
So
they just get trained that way. And so, they don't really know any different.
yeah. Yeah. So, what are some of the common things that you see that when women are, when they finally find you, what are some of the common diseases that you're seeing a lot of?
Well, a lot of painful periods or chronic pelvic pain, and then couples with infertility. But now that NaPro technology is becoming um, at least better known, I get young patients with like premenstrual syndrome or abnormal bleeding.
Yeah.
But the sad thing is, women with endometriosis, which is a disease that causes a lot of pain, from onset of symptoms to diagnosis is an average of 8 to 10 years. And so that's really a disgrace to my profession. And that's across the board. I mean, there's other doctors who treat endometriosis. It's not just NaPro technology doctors, but the way we treat it is unique. But across the board, women suffer for many years before they get a diagnosis.
So heartbreaking, and so much pain, right? When that's happening with their monthly cycle, that they're experiencing sometimes debilitating pain. And yeah,
But
so with
it is a strange disease because some women, their only symptom is they can't get pregnant
mm,
and they don't have the pain. So it's just a very strange disease.
yeah, yeah, definitely. So what is different about the NaPro approach to endometriosis?
Yeah, so first of all, we want to diagnose it and treat it, whereas kind of the mainstream approach is let's suppress the pain with, again, the birth control pill or the IUD or an implant, because they're fearful of doing a surgery and causing harm, which of course, surgery has its risks. Um, but the problem is it's a progressive disease. And so even if the medications work to treat the symptoms, the actual disease is continuing to grow
Sure.
because it's stimulated by estrogen. And so there's, fake estrogen in the birth control pill. It's not what your body would make. It's synthesized, but that's going to stimulate endometriosis regardless. And you can't go without some form of estrogen, or you would, go through menopause and have lose your bone density and all of those things. And sometimes they treat women by giving them medication that puts them into a pseudo menopause. But also, you can only be on that a total of 1 year because of the
Mm,
damage it causes on your bones. And of course, women feel miserable.
sure.
So all of those are kind of temporary fixes, or what I call band-aids. And so it doesn't get to the heart of the problem. And so what we do is we actually look inside and diagnose the disease. And so the gold standard is to look inside the belly button with the camera and diagnose the disease. So it is an outpatient surgery. But what we do that's really unique is, first of all, there is a fellowship training for OBGYNs if they want to go through that. So, you really need additional training to be able to identify the lesions and then also know how to treat them. So we have a very specific way that we look at all of the organs in the pelvis. So we look at the female organs, but then we also look at the appendix, large and small bowel, all the way up here at the diaphragm, liver, gallbladder, and then rectum, bladder. So we take the full tour, as I say,
Yeah.
and we actually videotape the surgery, everything on the inside. And the following day, we show the video to the patient and her husband or, parents, and explain everything and show what the lesions look like and where they're located. And then we often develop a plan as far as how to treat it, because you have to cut the lesions out in order to really treat it. So some doctors don't know that, so they go in and they burn the lesions, but that doesn't work
Mm,
because you can't tell if you actually, got to the base of the lesion. And so those patients end up having the pain come back relatively quickly. So
mm,
so then we cut the lesions out, and then what makes us even more unique is that we actually sew the healthy tissue back together.
mm,
So we don't want to leave a bunch of open wounds in the pelvis because that is like a scab on your knee. And so, things stick when they're healing.
mm,
So we don't want things to stick together because that causes pain. So we don't want to fix one problem and cause another. And so it takes a lot of time to do it well and attention to detail. So the whole process from start to finish is really specialized.
That's beautiful. So when women do have this excision surgery for endo, do you find that they oftentimes need to have repeat endo surgeries in the future, or does that depend
It
upon the
depends on
woman?
the age of the patient. If a young girl comes in age 17 or 18, I tell them, it will grow back. But generally it grows in new locations, not
Mm,
necessarily where we cut it out.
mm,
And there's a strong genetic component to this disease. But we do everything we can to boost a woman's own immune system, which is where, your expertise can come into play. Getting healthy in a lot of ways, sleep, diet, stress reduction. I can't prove that that's, um, decreases the amount of endometriosis that comes back, but it seems like a very common sense approach that, the healthier you are, the more you can kind of combat any disease.
yeah.
So we work with them on that. But the nice thing is for couples with infertility is that pregnancy actually suppresses the growth of endometriosis because
Mm,
you're not ovulating,
mm,
and you don't have that estrogen surge each month. And
sure.
then if you can breastfeed for as long as possible, that also inhibits ovulation. So and then if you just kind of have your kids close together, you could have several years where that endometriosis is not going to grow. And then menopause obviously will decrease any kind of growth of endometriosis. So there are
Mm.
some people who need a repeat surgery, but others, we treat it definitively, and then they're fine.
That's beautiful. Do you find, I find oftentimes when women are diagnosed with endometriosis or it's thrown around, this might be endo, um, it hits us like a ton of bricks, right? The fact that we might be facing this. So, do you see on your end of things that endo does become this definitive, not a death sentence, right? But this like definitiveness that it's going to be really hard to have a family or it's going to be really difficult to move forward from here.
It again, it's such a strange disease because I have patients who come to me after they're done having their family, and
Mm,
they're in their 40s and they're having tons of pain. And I
mm,
go inside surgically and see all of this endometriosis, and it's like, well, how did you get pregnant?
wow.
you know, a lot of times, the younger you are, the more you can overcome it.
Mm,
So, it's a very common disease. It's estimated at 10% of women, but I imagine it's higher than that because a lot of doctors don't look inside.
mm,
So, again, it's just hard to say, if it's definitively going to cause infertility. I remember when I was young, I had really painful periods, and I saw a urologist because of some bladder issues, and he mentioned, well, you probably have endometriosis. And I was like devastated because my sister-in-law has endometriosis and was never able to have children of her
mm,
own. She was able to adopt. So I was really upset by that comment, and so
wow.
um, but I never experienced infertility, and
Mm,
I did have a surgery, and I had a mild amount of endometriosis, but so you just can't really, it's not black and white. You can't say whether someone's going to have trouble or not. But when I take care of really young girls, I tell them, like, this is the best thing you can do is cut it
mm,
out, remove it, and so that it doesn't continue to grow and cause problems. And of course, chronic pain is very bad for your overall health. And it's been proven that if you have chronic pain for a year or longer, you have a very high risk of developing anxiety and depression.
mm,
And a lot of women with endometriosis, I think, have a kind of a justified depression in the sense that they're not listened to. And a lot of them are kind of told that it's like in their head, or, they just are, less
mm,
tough than other women. And so, and just having no answers,
yeah,
leads to um, a lot of mental anxiety.
sure. Understandably. Oh, it's so heartbreaking. So, as these women that have been struggling with this pain and have been dismissed or brushed aside come to your office, and even for those that are not blessed to have had you as a part of their journey, what is it that you say to them or that you want to say to them?
Well, I mean, honestly, the best thing I can do for patients is listen and, validate their concerns and their symptoms and then try to get them answers. I tell my couples with infertility, I can't guarantee that you'll have a pregnancy in the future, but I can guarantee that I'm going to help restore your health and you're going to feel better.
Yeah.
And so, um, I just tell women, like, you don't need to suffer. You don't need to suffer with premenstrual syndrome. You don't need to suffer with pain.
Yeah.
We can find answers. There are treatments. So I just, I just don't want women to think that that's part of normal life.
Yeah, that's beautiful. Um, do you do often do surgeries for women with PCOS?
Yes, yes, that's another disease it's a very common disease as well.
Yeah. Yeah. Would you
Um,
mind talking for a moment about because I know there is some controversy within, especially surgical procedures in regards to PCOS. Would you mind explaining when PCOS does merit surgery, what that looks like and why that's different?
yeah, so not all women need surgery, which is nice. There's a spectrum of the disease, and so some women have like a variant or a mild case. And sometimes even one of the rare situations is one ovary looks polycystic and the other one doesn't.
Wow.
But again, that's pretty rare. So in the mainstream gynecology world, if you've been doing like 6 cycles of medication to help you ovulate and you can't get pregnant, then they would move on to another treatment.
Mm,
And for some reason, ovarian drilling has kind of been acceptable within the gynecologic community, but obviously there's a lot of push toward artificial insemination and in vitro fertilization as well. But I think the reason why ovarian drilling was originally kind of pushed is that you could do that surgery through small incisions.
mm,
And originally, when we did wedge resections, which is a different surgery for polycystic ovarian disease, we would have to make like a small C section type incision to be able to do that surgery. And so the ideology was that, well, you have to have small incisions to prevent scar tissue, which is actually not true. But
mm,
that's kind of how it evolved. Now, ovarian drilling has worked for fertility, but it is sort of barbaric. I mean, it's
mm.
as it sounds. You drill
Wow.
holes into the ovary,
Wow.
and there's no standardized technique. Like, how many holes do you drill?
Mm,
Um, and so it actually can cause a lot of scar tissue because, again, you're creating a lot of open wounds on the ovary.
wow.
So wedge resection is actually very simple from a technique standpoint. And you literally cut a wedge out of the ovary, but we don't just leave it that way. We sew it back together and we tuck in all the raw edges and leave only smooth surfaces.
Mm,
And the goal is to leave behind a normal sized ovary. Now, if you watch the surgery, it seems counterintuitive, right? Like removing part of the ovary increases your fertility. That doesn't make a lot of sense. But a lot of those cysts that are there are producing estrogen. And so that causes difficulty because your brain thinks that you have all the estrogen you need. And so it doesn't kick out the hormones to help you ovulate. And then, of course, those cysts also make androgens, so the male hormones that affect your fertility as well. So
mm.
while the ovary is open, we can pop all the cysts that we see, and it works really well as far as fertility goes.
Oh, that's really neat. So with
Well,
women with PCOS, do you see that happen a lot where they need to have the surgery, or how do you go about assessing that?
well, by the time they get to me, usually they do need the surgery. But if I have local patients who haven't necessarily been through the medication route, then I always start there.
Mm.
And then now that with the invention of the robot, we are able to do wedge resections through small incisions.
Oh,
So
wow.
that's really nice for the patients. So I was really hoping that there would be kind of a surge of interest in performing wedge resections, even by mainstream gynecologists, because, like I said, it's very simple to do, very effective, and they can do it using the robot. But unfortunately, I haven't seen that surge yet, but hopefully in
Hmm.
the future.
Yes, I hope so. It seems to kind of go hand in hand with so much with women's health that we're not seeing more diving deeper. We have well-established Band-Aid solutions, whether that's, something like IUI and IVF or something smaller like the pill or the IUD. And unfortunately, that I feel like that seems to be just a consistent standard of care instead of a new way we can plumb those depths to really figure out what is going on and how we can heal the body. But I'm so
And
thankful for doctors like you that are doing those things.
I'm grateful that I found out about it at such a young age.
Yeah.
And the patients where we do the wedge resection, it's funny because you've never seen a woman so excited to get her period, like on her own. I mean, usually women are, it's kind of a nuisance, but yeah, they'll call and say, I got my period on my own. I didn't need any medications. So,
Yes, it's
I mean, they're
beautiful.
really happy to have regular cycles and, kind of feel more normal.
Yes. Yes. I love that. That's really beautiful.
And obviously, there's a huge nutrition component with polycystic ovaries, so you probably see that a
Yeah.
lot.
Yeah, yeah, for sure. And I think sometimes explaining that to women when they haven't been told that, maybe they've just been told they have PCOS and here's what you can take for it. I find sometimes is the struggle to tell them that there's also a lot that they can do through their lifestyle and diet that can really help alleviate a lot of those symptoms that they experience within PCOS, especially since it is a metabolic disorder. Obviously, it can get out of hand, and we need surgery to help that continue to not snowball further. But yeah, for
Right,
sure.
but all of it is so important, and it's important for their long-term health.
Yeah,
I mean, what we do is not just, oh, you need to you want to get pregnant.
yeah,
Um, and so for some patients, they love to get pregnant, but
yeah,
their primary goal is just to get healthy and feel good.
yeah,
And, a lot of women with polycystic ovaries, they need to hear, it's harder for you to lose weight. It's,
yeah,
you have insulin resistance. This is going to be a challenge for you, because they may have siblings or friends who can
right.
eat whatever they want
Yes,
and not gain weight. So,
yeah.
it's just, it's a difficulty for them for sure.
Yeah, for sure. And so validating to hear that being said that it's not just you haven't tried hard enough. It's not just you haven't, it's that there's
Right.
actually something going on and the with your hormones and on the chemical level that is making this more difficult for you for sure.
Exactly.
Yeah, that's beautiful. So is there anything else that you would like to share with anyone that will watch this in the future? Anything you'd like to say to them?
Yeah, so the name of my practice is Vivify Women's Health and Fertility. And vivify means to bring to life or invigorate.
Beautiful.
And I feel like that's what we do with NaPro technology. A lot of patients believe, that now they have their life back.
Yeah.
And so I designed the name and I put women's health first and
Mm.
fertility second because I really think that's the order of importance. We need to restore health, and then you can move on to, making choices about your family. So I put a lot of thought into that. And yeah, so I love what I do.
Beautiful.
I do telehealth. I have my license. I will have it in 25 states eventually. Some of the
Beautiful.
processes are longer than others, but
Sure.
telehealth is perfect for what we do. Women chart their cycles, and I can get so much information just from the chart and the
Mhm.
history.
Yeah,
And so obviously if they need surgery, they'd have to come here to Omaha, Nebraska, but sometimes they can find a NaPro surgeon closer to them. And so I'm hoping that telehealth will expedite the patient's ability to access NaPro technology and then, help them to get answers sooner.
for sure. That's so beautiful. I love so much that you're really branching out with your telehealth because I think too it's really intimidating to meet a doctor for the first time and have them cut you open right then. This is
Right.
what we're here for. So it's such a blessing for them to be able to get to know you through those telehealth appointments beforehand. And I'm so thankful that you're licensed in my state of Kentucky, but I know there's a lot more other states that you're also licensed in. So for those of you that are interested in following up with Dr. Kristina Pakiz, she has her website is vivifyfertilityhealth.com, and she is just such a wonderful resource and such a blessing in the realm of women's health. I'm so thankful that you're doing this great work.
Thank you for your interview and the opportunity to share my story. I do have a pop-up window on the website that tells all the states that I have
Beautiful.
licensure in and
Awesome.
the insurance companies that I'm in network with so that
Oh, beautiful.
patients can be informed.
Yeah. Oh my gosh, that's so helpful because so often this stuff is really difficult to get covered under insurance and to dig into all of that is a lot of work. I love that you made that so easily accessible. Thank you so
Yeah,
much. Thank you for all
so
you do and for your time today.
thank you for all that you
Yeah.
do.